I want to tell you about something that happened during a routine follow-up appointment that I have thought about many times since. A patient of mine, a 73-year-old woman I will call Eleanor, had been managing high blood pressure for 8 years, 2 medications, consistent, faithful. She never missed a dose. And yet every morning when she took her blood pressure at home, the numbers were stubbornly elevated, not dangerously high, but not where either of us wanted them. Systolic readings consistently in the 148 to 156 range, despite the medications, despite the dietary changes we had discussed, despite the walking she did every afternoon without fail. At this particular appointment, almost as an afterthought as she was gathering her things to leave, she mentioned something. She said she had started drinking a small glass of something warm before bed about 6 weeks earlier, a habit her sister had recommended. She had not mentioned it because she did not think it was medically relevant. She assumed it was just a comfort drink. I asked her what it was. She described it. I asked her when she had started noticing her morning readings improve. She thought for a moment and said about 5 or 6 weeks ago. I asked her to keep a 2-week log of her nightly drink and her morning blood pressure reading. What she brought back 2 weeks later made me sit down and look at the numbers 3 times before I said anything. Her average morning systolic reading had dropped by 14 points compared to the 8 weeks prior. 14 points from a drink before bed. My name is Dr. Victor Asante. I am a cardiologist with 20 years of clinical practice focused on hypertension management in older adults. And today I am going to tell you exactly what Eleanor was drinking, why it worked, what the science says about nighttime blood pressure, and the specific compounds in certain beverages that influence it, and how to use this information starting tonight. But before I tell you about the drinks themselves, I need to explain something about blood pressure at night that most patients have never been told. Because without this context, the drinks are just drinks. With it, they become something genuinely powerful. The nighttime blood pressure problem nobody explains to seniors. Most people think of blood pressure as a relatively stable number. You go to the doctor, they take a reading. That number represents your blood pressure. Maybe it goes up a little when you are stressed, down a little when you rest, but fundamentally stable. This understanding is incomplete in ways that matter enormously for cardiovascular risk. Blood pressure follows a circadian rhythm, a 24-hour biological cycle governed by your autonomic nervous system, your hormonal patterns, and your sleep architecture. In a healthy cardiovascular system, blood pressure drops by approximately 10 to 20% during the nighttime sleeping hours compared to daytime levels. This drop is called nocturnal dipping, and it is not a minor physiological footnote. It is one of the most important cardiovascular protective mechanisms your body performs every night. During the dipping window, when blood pressure falls, several things happen simultaneously in the cardiovascular system. Arterial walls experience reduced mechanical stress, allowing microscopic damage from daytime pressure to begin repairing. The heart works at a lower workload, reducing oxygen demand and allowing cardiac muscle to recover. Inflammatory markers in the arterial walls decrease, and the kidneys have an opportunity to excrete sodium more efficiently, helping maintain the fluid balance that directly influences blood pressure. When nocturnal dipping is preserved, meaning blood pressure falls appropriately during sleep, the risk of heart attack, stroke, and cardiovascular death is substantially lower than population averages. When nocturnal dipping is absent or blunted, meaning blood pressure stays elevated throughout the night or rises during sleeping hours, the cardiovascular risk profile changes dramatically. A landmark study published in the journal Hypertension followed over 3,000 patients over an average of 5 years, using 24-hour ambulatory blood pressure monitoring. The findings were striking. Non-dippers, patients whose blood pressure did not fall appropriately during sleep, had significantly higher rates of cardiovascular events including heart attack and stroke compared to dippers, even when their average daytime blood pressure readings were similar. The nighttime pattern mattered independently of the daytime number. In adults over 60, nocturnal dipping is frequently impaired. The reasons are multiple and overlapping. Autonomic nervous system function changes with age, reducing the parasympathetic activity that drives the nighttime pressure drop. Sleep architecture becomes more fragmented, with less time in the deep slow-wave sleep stages, during which the most significant dipping occurs. Kidney function declines, impairing the overnight sodium excretion that supports blood pressure reduction, and conditions extremely common in older adults, including sleep apnea, arterial stiffness, and diabetes, all independently blunt the dipping response. The result is that a disproportionate number of older adults are spending their nights with blood pressure that is too high, doing damage to arterial walls, stressing the heart, and generating cardiovascular risk during the very hours their bodies most need rest and repair. And here is where what you drink before bed becomes clinically relevant. Certain beverages contain specific bioactive compounds that, consumed in the hours before sleep, act on the mechanisms governing nocturnal blood pressure through multiple simultaneous pathways. They are not drugs. They do not act with the speed or magnitude of medication, but they work. The evidence says they work. And for Eleanor, and for many of my patients since, they work in ways that show up clearly in the morning readings. Let me tell you about each one. starting with the one Eleanor was drinking. Drink number 1. Hibiscus tea, the most evidence-backed beverage for blood pressure. This was Eleanor's drink. Her sister had read about it somewhere and passed it along as folk wisdom. It turned out to be one of the most well-supported dietary interventions for blood pressure in the nutritional medicine literature. Hibiscus sabdariffa is a flowering plant whose dried calices, the deep red outer petals, have been used in traditional medicine across Africa, Central America, and Southeast Asia for centuries. The beverage made from steeping these calices, known as hibiscus tea, or by various regional names including agua de Jamaica and carcade, has been studied in over a dozen randomized controlled trials specifically for its effects on blood pressure. The mechanisms are multiple and well characterized. First, hibiscus contains high concentrations of anthocyanins, the same class of flavonoids found in blueberries that stimulate nitric oxide production in blood vessel walls. Nitric oxide dilates arteries directly, reducing vascular resistance and blood pressure. Second, hibiscus has documented ACE-inhibiting activity. Specific organic acids in the plant, including hibiscus acid, inhibit angiotensin-converting enzyme through a mechanism that pharmacologically parallels the action of ACE inhibitor medications, one of the most commonly prescribed blood pressure drug classes. Third, hibiscus has a mild but measurable diuretic effect, promoting overnight sodium and fluid excretion through the kidneys. This directly supports the nocturnal blood pressure dipping mechanism I described. The clinical evidence supporting these mechanisms is substantial. A meta-analysis published in the Journal of Hypertension analyzed 5 randomized controlled trials involving 390 patients and found that hibiscus tea consumption was associated with a mean reduction in systolic blood pressure of 7.6 millimeters of mercury and diastolic pressure of 3.5 millimeters. A subsequent larger meta-analysis incorporating additional trials confirmed these findings and noted that the effect was most pronounced in patients with hypertension, the population that needs it most. A specific trial published in the Journal of Nutrition randomized hypertensive adults to drink 3 cups of hibiscus tea daily versus placebo for 6 weeks. The hibiscus group showed a mean systolic reduction of 6.9 points compared to 1.3 points in the placebo group. And critically, the effect was dose-dependent, meaning higher hibiscus concentration produced greater reduction. For the nighttime application specifically, a cup of hibiscus tea consumed 30 to 60 minutes before bed positions its peak ACE-inhibiting and vasodilatory activity during the early overnight hours when nocturnal dipping is most critical. The practical preparation matters. Use dried hibiscus calices, available at most health food stores and many grocery stores, rather than hibiscus-flavored tea bags, which often contain minimal actual hibiscus. Steep 1 to 2 teaspoons of dried calices in 8 ounces of hot water for 5 to 10 minutes. The resulting tea is deeply red, tart, and slightly cranberry-like in flavor. A small amount of honey can be added if the tartness is too pronounced. Serve warm rather than iced for a bedtime drink. One important note: hibiscus has blood pressure-lowering effects that are meaningful enough that patients on antihypertensive medications should monitor their readings more closely when beginning regular consumption. Discuss it with their doctor, as additive effects may require medication adjustment. This is a benefit, not a warning against use. It is simply a reason to keep your doctor informed. Eleanor was steeping 2 teaspoons of dried hibiscus in hot water every evening at 9 p.m. By 10 p.m. she was in bed. Her morning readings had dropped 14 points in 6 weeks. Drink number 2. Tart cherry juice. The sleep and blood pressure combination. This one addresses 2 interconnected mechanisms simultaneously, and that combination is what makes it particularly valuable for older adults specifically. Tart cherries, specifically Montmorency cherries, contain extraordinarily high concentrations of several bioactive compounds relevant to cardiovascular health. They are among the richest known food sources of melatonin. They contain high levels of anthocyanins with potent anti-inflammatory and vasodilatory properties, and they contain specific phenolic compounds that have demonstrated ACE-inhibiting activity in laboratory and clinical studies. The melatonin content is directly relevant to the nocturnal dipping problem I described. Melatonin is not simply a sleep hormone. It has direct cardiovascular effects that have been the subject of increasing research attention. Melatonin receptors are present in the walls of blood vessels throughout the body. When melatonin binds these receptors during the nighttime hours, it promotes vasodilation, reduces the activity of the sympathetic nervous system that drives blood pressure upward, and has antioxidant effects on arterial wall cells that reduce inflammation-driven stiffness. Multiple studies have found that melatonin supplementation improves nocturnal blood pressure dipping in non-dippers, specifically the population of patients whose nighttime blood pressure reduction is impaired. A study published in the Journal of Hypertension found that controlled-release melatonin reduced nighttime systolic blood pressure by 6 points and diastolic by 4 points in patients with non-dipping hypertension. The effect was specific to nighttime readings. Daytime blood pressure was unchanged. The melatonin was acting precisely on the nocturnal dipping mechanism, Tart cherry juice delivers a meaningful dose of naturally occurring melatonin alongside the anthocyanin and phenolic compounds that address vascular tone and inflammation through separate pathways. The combined effect on overnight cardiovascular physiology is greater than the melatonin effect alone. A clinical study from Northumbria University found that adults who consumed 30 milliliters of tart cherry juice concentrate twice daily showed significant improvements in sleep duration and sleep efficiency compared to placebo, and improved sleep architecture, specifically more time in deep slow-wave sleep, independently promotes better nocturnal blood pressure dipping. The mechanisms reinforce each other. Better sleep produces better dipping, and the compounds in tart cherry juice promote both better sleep and better vascular tone simultaneously. The practical application for bedtime use is 30 milliliters, approximately 2 tablespoons, of tart cherry juice concentrate diluted in 6 to 8 ounces of water, consumed 30 to 60 minutes before bed. The concentrate form is more practical and more potent than bottled tart cherry juice. Look specifically for Montmorency cherry concentrate without added sugar. The taste is pleasantly tart and slightly sweet, notably more palatable than straight hibiscus tea for many people. For patients who want to address both blood pressure and sleep quality simultaneously, tart cherry juice before bed is one of the most elegant and evidence-supported single interventions available. The two mechanisms work in parallel, each reinforcing the other, and the result appears in both the quality of overnight sleep and the morning blood pressure reading. Drink number 3. Warm skim milk with nutmeg. The peptide and mineral pathway. This one connects to a mechanism that surprises most people because it involves a component of milk that most nutritional discussions never mention. Milk contains proteins called caseins and whey proteins. When these proteins are digested, they are broken down into smaller peptide fragments. Specific peptides derived from milk proteins, particularly two called IPP and VPP, have documented ACE-inhibiting activity in human clinical studies. They work through exactly the same hormonal pathway as ACE inhibitor medications, reducing the conversion of angiotensin I to angiotensin II, a potent vasoconstrictor that raises blood pressure. A meta-analysis published in the Journal of Human Hypertension examined 12 randomized trials on milk-derived peptides and blood pressure. The analysis found a statistically significant reduction in systolic blood pressure of 4.8 millimeters and diastolic of 2.2 millimeters associated with regular consumption of these peptides. The effect was consistent across studies and more pronounced in subjects with higher baseline blood pressure. Beyond the peptide mechanism, milk is one of the most bioavailable dietary sources of calcium, magnesium, and potassium, the three minerals most directly involved in blood pressure regulation. Calcium influences the contraction and relaxation of vascular smooth muscle. Magnesium, which I have discussed at length in other contexts, is essential for the electrical stability of cardiac cells and the flexibility of arterial walls, and potassium promotes overnight sodium excretion by the kidneys, directly supporting nocturnal dipping. The warmth of the milk matters for the bedtime application. Warm milk increases the release of tryptophan, an amino acid that serves as a precursor to both serotonin and melatonin in the brain. The resulting mild increase in melatonin production adds the same nocturnal dipping benefit we discussed with tart cherry juice, through a different pathway but toward the same physiological end. Nutmeg, added in a small amount, approximately 1/4 teaspoon per cup, contains myristicin and other compounds with mild sedative and vasodilatory properties. Traditional use of nutmeg as a sleep aid has some preliminary pharmacological support. At culinary doses, it is completely safe. At very large amounts, it is not, but a 1/4 teaspoon in a cup of warm milk is well within the range of normal culinary use, with no safety concern. The preparation is simple. Heat 8 ounces of skim or low-fat milk until warm but not boiling. Add 1/4 teaspoon of ground nutmeg and stir well. Consume 30 to 45 minutes before bed. The result is a warm, gently spiced, slightly soporific drink that most people find genuinely pleasant. For seniors who are lactose intolerant, unsweetened oat milk is a reasonable alternative. Oat milk contains beta-glucan, a soluble fiber that has its own documented blood pressure-lowering properties through mechanisms involving gut microbiome modulation and cholesterol reduction. The peptide content is lower than dairy milk, but the mineral and beta-glucan content makes it a meaningful alternative. Drink number 4. Chamomile and lemon balm tea. The cortisol and nervous system pathway. This combination addresses a mechanism that is particularly relevant to older adults, and that is almost never discussed in blood pressure management conversations. The role of evening cortisol in sympathetic nervous system activity and preventing nocturnal blood pressure dipping. Cortisol is the primary stress hormone. In a healthy circadian pattern, cortisol is highest in the early morning, driving the body's awakening response, and falls progressively through the day to its lowest levels in the late evening and overnight hours. This evening cortisol decline is one of the signals that allows the parasympathetic nervous system to dominate during sleep, facilitating the cardiovascular rest state and nocturnal blood pressure dipping. In many older adults, this evening cortisol decline is blunted. Chronic low-grade stress, poor sleep quality, inflammatory conditions, and the dysregulated autonomic function that accompanies aging all contribute to cortisol levels that remain inappropriately elevated in the evening hours. When cortisol stays up, the sympathetic nervous system stays active. When the sympathetic system stays active, blood pressure stays elevated, nocturnal dipping is impaired, and the cardiovascular repair work that should happen overnight does not fully occur. Chamomile contains apigenin, a flavonoid compound with well-documented anxiolytic and mild sedative properties. Apigenin binds to benzodiazepine receptors in the brain, the same receptors targeted by anti-anxiety medications, though with much lower affinity and without the dependency or cognitive risks associated with pharmaceutical agents. The result is a genuine reduction in nervous system arousal that supports the parasympathetic shift needed for proper nocturnal dipping. A randomized controlled trial published in the journal Phytomedicine found that chamomile extract significantly reduced generalized anxiety symptoms and improved sleep quality compared to placebo over an 8-week period. The mechanism of action through apigenin and GABA receptor modulation is well characterized. Lemon balm, Melissa officinalis, works through a complementary mechanism. It inhibits the enzyme GABA transaminase, which breaks down the inhibitory neurotransmitter GABA in the brain. When GABA levels are higher, nervous system inhibition is greater, sympathetic activity decreases, and the body more easily enters the parasympathetic state conducive to blood pressure dipping. A double-blind crossover trial found that lemon balm extract significantly reduced anxiety and improved mood and calmness compared to placebo, with an onset of action within 1 to 3 hours of consumption. Combined in a single evening tea, chamomile and lemon balm create a synergistic reduction in evening sympathetic nervous system activity that supports the cortisol decline and parasympathetic shift needed for proper nocturnal dipping. The blood pressure benefit is indirect, but physiologically coherent and clinically meaningful. Preparation is simple. Steep 1 chamomile tea bag, or 1 teaspoon of dried chamomile flowers, alongside 1 teaspoon of dried lemon balm leaf, in 8 ounces of hot water for 7 to 10 minutes. The resulting tea is delicate, slightly floral, and mildly sweet without any addition. Consume 45 to 60 minutes before bed. This is the drink I recommend most specifically to patients whose elevated morning blood pressure readings are accompanied by difficulty falling asleep, nighttime waking, or reports of feeling anxious or mentally busy in the evening hours. These are the patients in whom the cortisol and sympathetic pathway is most likely to be the dominant mechanism driving impaired dipping. Drink number 5. Warm water with magnesium glycinate. The mineral therapy, I want to include this one because it addresses what I believe is the single most prevalent and most correctable nutritional deficiency affecting blood pressure and nocturnal cardiovascular function in older adults: magnesium deficiency. I have discussed magnesium in previous conversations in the context of PPI medications depleting it, and in the context of its role in cardiac electrical stability. But I want to address it directly here as a targeted bedtime intervention, because the evidence for its specific impact on overnight blood pressure is compelling, and because the prevalence of inadequate magnesium status in adults over 60 is genuinely alarming. Studies consistently find that between 30 and 50% of older adults in developed countries have magnesium intake below the recommended daily allowance. And the RDA itself, 320 milligrams per day for women and 420 milligrams per day for men, may underestimate optimal requirements for cardiovascular function. Magnesium is depleted by stress, by alcohol consumption, by many common medications including diuretics and PPIs, and by the reduced gut absorption efficiency that accompanies aging. Magnesium's role in blood pressure regulation operates through several simultaneous pathways. It is a natural calcium channel blocker, meaning it competes with calcium for entry into vascular smooth muscle cells. When calcium enters these cells, the muscle contracts, narrowing the blood vessel and raising pressure. When magnesium occupies calcium channels, this constriction is reduced and vessels relax. This is mechanistically identical to the action of calcium channel blocker medications, one of the most commonly prescribed antihypertensive drug classes. Operating through the same receptor system, magnesium also directly activates the sodium-potassium ATPase pump in cell membranes throughout the body, promoting the sodium-potassium balance that governs kidney fluid regulation and blood pressure. And it supports the parasympathetic nervous system function that enables nocturnal blood pressure dipping through its role in neurotransmitter synthesis and autonomic nerve conduction. A meta-analysis published in the American Journal of Clinical Nutrition analyzed 34 randomized controlled trials involving over 2,000 participants. The conclusion was clear. Magnesium supplementation significantly reduced systolic blood pressure by 2.0 millimeters and diastolic by 1.78 millimeters on average, with greater effects in studies achieving higher serum magnesium levels and in patients who were deficient at baseline. The specific form of magnesium matters significantly for bedtime use. Magnesium glycinate, magnesium bound to the amino acid glycine, has 2 advantages over other forms. First, it has superior bioavailability compared to magnesium oxide, the most commonly sold form, which is poorly absorbed. Second, glycine itself has independent sleep-promoting and blood pressure-supporting properties. A study published in the journal Neuropsychopharmacology found that glycine supplementation before bed improved sleep quality and reduced daytime sleepiness by improving the quality of overnight sleep architecture specifically. The bedtime application is 200 to 400 milligrams of magnesium glycinate dissolved in warm water. Consume 30 to 60 minutes before sleep. The water should be warm rather than cold because warm fluids consumed before bed support core temperature regulation in ways that facilitate sleep onset and quality. Please discuss magnesium supplementation with your doctor if you have kidney disease, as impaired kidney function can affect magnesium clearance. For patients with normal kidney function, magnesium glycinate at these doses is extremely well tolerated with no meaningful side effect profile at the amounts recommended here. Now let me bring all 5 together into a practical framework you can use starting tonight. The 5 drinks we have covered each act on a different mechanism governing nighttime blood pressure. Hibiscus tea acts on the ACE pathway and directly dilates blood vessels. Tart cherry juice acts on melatonin pathways to improve nocturnal dipping and sleep architecture. Warm milk with nutmeg delivers blood pressure supporting peptides and minerals alongside gentle sleep promotion. Chamomile and lemon balm tea reduce evening sympathetic nervous system activity and support the cortisol decline that enables proper dipping. And magnesium glycinate in warm water addresses the most prevalent mineral deficiency affecting cardiovascular function in older adults. You do not need to drink all 5. You need to start with one. My recommendation for choosing which one is simple. Match the drink to your most prominent pattern. If your primary problem is high morning readings that do not respond well to medication, start with hibiscus tea. Its ACE-inhibiting and vasodilatory mechanisms act most directly on the blood pressure number itself. If you also struggle with sleep quality or wake frequently during the night, start with tart cherry juice. The dual sleep and blood pressure benefit makes it exceptionally efficient. If you are a poor sleeper whose elevated evening stress or anxiety you recognize as contributing to your blood pressure pattern, start with chamomile and lemon balm. If you take a PPI, a diuretic, or have any reason to suspect magnesium depletion, start with magnesium glycinate in warm water and discuss testing your magnesium level with your doctor. And if you simply want the most palatable, familiar, and comforting option, warm milk with nutmeg delivers real physiological benefit in the form most people already associate with a good night's rest. Whatever you choose, consistency is the variable that determines whether it works. A single cup of hibiscus tea does nothing measurable. 30 consecutive evenings of hibiscus tea can move your systolic reading by 6 to 14 points. The mechanism requires sustained input to produce sustained effect. Eleanor continued her hibiscus tea every night for 14 weeks. When her cardiologist reviewed her home readings at her next appointment, he asked what she had changed. She told him. He looked up the research that same afternoon and has recommended it to patients ever since. A single warm cup before bed. A 14-point drop in systolic pressure. A woman who finally felt like she was doing something active for her own health after 8 years of pills that felt passive. That is what this conversation is for. Tell me in the comments which drink you are going to try tonight. And if someone you know is lying in bed every night with a blood pressure that is too high, share this with them before they go to sleep. Your nighttime hours can work for your heart. Let them.